Hello viewers. People with the substance use disorder facing greater challenges during the COVID-19 pandemic, like stress, craving, hopelessness. Stress, other factors can enhance substance cravings and contribute to the relapse. The stress from the social isolation and other COVID-19 related life changes can lead to substance use and misuse also. Today, we will discuss about mental health and psychological needs of the substance use disorder and what can we do to help those in the recovery. And we will also discuss about the treatment guideline during the crisis. Please send your message and stay with us. Today, our four speakers attending this live program from four Asian countries, Philippines, Indonesia, Thailand, and our neighbor India. I'm going to my friends and let's introduce each other. I'm starting with Aditi. Please introduce yourself and a little bit about your organization and your work also. Aditi.
Yeah. Thank you, Iqbal. First of all, thank you for inviting me for this dialogue. And it's lovely to meet all my colleagues after a very long time. So hello to everybody. I am actually a addiction professional and I'm an ISAP Master Global Trainer. I have also worked as a counselor in a TTK hospital in Chennai for 15 years. So I have a clinical experience also, and I'm now training for UNODC also. Thank you.
Thank you, Aditi. I'm going to Junjun from Philippines. Please introduce yourself and talk a little bit about your organization, your work experience to our viewers.
Good evening, classmates. Good to see you again. And this is all new to me doing these things online. So we were able to attend the training last week on peer counseling. So this is my second time, but my first time on this platform. My name is Junjun. I'm a addiction counselor and I own a rehab, a clinic here in Baguio in the Philippines. So I've been doing this for the past since 1993. I'm a global master trainer and a lot of other stuff, So, and I'm glad to be able to see my classmates here again. And I was able to get a haircut a few days ago and shave. I don't know about Tanay. He looks like he's growing hair. Two caterpillars coming together somewhere. But it's,
Thank you.
so
Thank you.
hoping for we have a lot of people wanting to watch the show, so trying to get the show, share them the link. So let's have. I'm looking forward to a fruitful discussion.
Thank you, Junjun. I hope our discussion will be very live and very fruitful. I'm going to Dr. Danai, is a very renowned psychiatrist in Bangkok. Mr. Danai, please introduce yourself and you tell about your work and professions to our viewers.
Hello, everyone. My name is Danai. I'm not sure can you hear me clearly?
Yes, we are hearing. Introduce yourself. You tell about yourself.
Because my signal is not good yet. So I'm from Bangkok Hospital, Chiang Mai, Chiang Mai, Thailand. And right now I work as a psychiatrist in the private hospital. Okay. So during the COVID, yes, there are some change, many things changes. And also I think all the people in our country are affected by this COVID outbreak. Okay. So for example, like about there, we have to adapt to our new lifestyle, like social distancing, and also there are some worries and fear about infections, and also yes, of course, about other things. Actually, not only about the COVID itself, but about the consequences after that, like about economic systems or other things. So that makes people stress.
Dr. Danai, could you use your headphone that your sound will be clear?
Just a moment.
If you, And now I'm going to Rachita. I hope you are fine and doing well in your country. Please introduce yourself and tell about your professional work and also your family.
Okay, hello everyone. First of all, I would like to say thank you very much for Mr. Iqbal and Amy for inviting me to join in this wonderful online session. It is a great initiative during this pandemic to create an online discussion so we can keep contact and updating about our condition and realities in order to serve people with SUD. So I also would like to say hello to my fellows here, Junjun, Adi, Kirot, and Selatai. It's very happy to see you now. It's been a while since the last time we spoke in Colombo. So I'm really happy that I can see you now live in actual space. And now I'm starting to introduce about myself. I am Rosita Dewi Karanel, and I'm working as an addiction counselor for drug rehabilitation center of National Narcotics Board of Indonesia. And for information, the National Narcotics Board, or BNN, has 6 facilities of rehab center in Indonesia. And my facility is the biggest, I think not only in Indonesia, but also in Southeast Asia, right, Junjun? Because Junjun ever visited my facility in 2012, right? Yeah. Yeah, and then we have like 153 Asian clients in our facility, and they came from different backgrounds, and we split them into 3 categories, like adolescent clients, female clients, and also male adult clients. And as a government institution, we provide our clients with one processing center to keep them into medical rehab and also social rehab centers. So maybe that's the general information about myself and what I'm doing in my organization now at Ipal.
Thank you, Rachita. Now I'm going to Danai. Danai, are you hear me?
Yeah, I
Are
can
you
hear you
here?
now.
Oh, nice.
Can you hear Okay.
Yes, very clear, very clear.
Okay, sorry for technical error.
Yes. Thank you, Danai, for your time. Basically, first, I'm asking first question to you. Are the people in your country facing any extra stress and mental health distress during the COVID-19 crisis? What are you doing to overcome this distress, this situation? Would you tell me a little bit about your work and also your country mental health distress during the COVID-19 situation?
Yeah. Okay. During the COVID outbreak now, I think most of the first reaction is about is fear, and also they are afraid about that something bad would happen. Is there any other serious consequences, for example? Okay, and they try to adjust because they're not sure what will happen next, what would government response to some our policy. So fear and anxiety was very common for the first initial part of states, but the things that we are doing right now, we try to address on about anxiety and other things. Okay, and we try to adjust actually for vulnerable patients like psychiatric patients or patients with substance use problems. For example, about try to educate the patients and also to address especially for screening, and also we do more the works for with the community as well about with some area which has a positive patient with positive for COVID infections. Mm-hmm. Oh my God.
Sorry, Iqbal, we can't hear you. Please unmute your mic.
Thank you, Rachita.
Okay.
Yeah, thank you, Danai, for your discussion. Hello, viewers. If you have any question, please you can ask to our Danai and other speakers because they are very renowned in our region and especially in SUD field. So they can guide you. They can explain a little bit more about SUD situation in our Asian countries. Now I am going to Aditi. Aditi, you are a researcher, you are a counselor, you are a global trainer. So many activities you are doing. And at this situation, what are the precautions that the treatment and rehabilitation centers are taking to prevent COVID-19 in your country? Not only your organization, if you go a little bit to your others organization, how they are maintaining the precaution to prevent the COVID-19? Would you tell this question?
Yeah. So coming to the rehab centers, most of the rehab centers which were attached to the medical hospital or a medical clinic were open throughout the lockdown period. Uh, even the rehab centers which were not in the red zone or which was not in the containment zone were also open, but of course with a lot of guidelines followed and precautions taken, like sanitation and hygiene. Most of the patients which were admitted were wearing all the time mask, and the staff was wearing that. Also, the third one, where social distancing was maintained and they were running centers like that. This was one thing where, in case the patient developed a medical problem, then they were attached to a bigger medical hospital where they could shift the patient over there. One more thing they did was, during the admission of the patient, they would definitely screen for many other things, but definitely for COVID. And in case there were any symptoms related to the COVID, then they would transfer the patient to a medical hospital for further investigation. One more thing they did now, rehab centers which were in the containment zone or the red areas, which is like in Chennai, especially. So they were closed down completely, but that did not mean that, the patients did not receive any inputs. Basically, there was online counseling. Then there were online psychoeducation classes for the patients and the family members. The classes included, like, managing triggers, spending time constructively, managing anger, frustration. Okay, for family members, there were classes like handling emotions, being supportive to the recovering person, and also self-care. So some of the psychoeducation classes were designed that way and given online. Having said that, there were also some recovery, support groups, and where AA members would share, and they were sharing a lot of reflections, and that helped the recovering patient sitting at home. To add to this, they also had YouTube videos made, 3 to 5 minutes YouTube videos where, they were handling craving, a few points about handling cravings, withdrawals, managing anger. They talked about domestic violence because of the anger, rise in anger and frustrations because of this shadow pandemic. There were a lot of domestic violence cases, and there were helplines set in where patients could actually call in and take help if needed. So these were some of the things the rehab centers were doing, and the patients were being helped all along.
Thank you, Aditi. I'm coming to Danai again.
Yes.
Are you facing any domestic violence related cases? Are you dealing with this in Thailand? Domestic violence related cases?
Yes, there are more reports also for domestic violence or maybe fighting, and also I think more relationship problems, because most of the family usually sometimes they spend time outside and they don't live together for a long time. But right now we have more like a couple conflicts or family issues problems that comes for the service, like how to spend the time. Usually they spend the time just about maybe 1 or 2 hours a day, but right now they have to stay together for 24 hours for many weeks.
Thank you. Now I'm coming to Junjun. What are the difficulties that you have been facing while providing psychological support to the recovery patients at this situation? How to overcome this situation, especially to serve the recovery people? Junjun, unmute your microphone. Yes.
Yeah. Because we are basically our facility is we're kind of outpatient, so there was a big adjustment for our clients when suddenly there was a we call it a community quarantine. No? So that means free movement and curfew. The movement was restricted, very restricted. It came to a point where it was down to 6 hours, or no, 6 hours, no, 12 hours a week, twice, 6 hours twice a week. And also the another adjustment was the sanitation, the protocols. So people coming in, we couldn't allow visitors anymore. They could not go out. So the meetings, especially the support meetings, they could not attend. They had to be all held here, and so basically freedom issues, and and for me that was stressful because my relievers could not come also here. So I've been with my clients for the last 3 months, and so that's actually the stress was coming from the thought that the self-care, the usual self-care activities that I usually do, like going to the beach, going to the mall, going shopping, eating out in restaurants. I could not do, you know? And neither could we in the beginning. We could not order also food. There were no deliveries, no packages coming in. Basically, Baguio was in total isolation, but that was good. I was all for it because that basically limited. We have had very few cases, so it's been 90 days. So we've had about here in the city, we've had only about 40 cases from the start. So that's pretty good. And most of those cases came from the people who were coming in from Manila. So what I did with the clients, for the clients, it was I had to give my stress was uh, I was suddenly put in a position where there was no one to rely on except me. That was the feeling, So I could not afford to. I mean, there was the stress or the pressure of being healthy, and so that's still stressful up to now. Because I did not have the usual activities that I do to take care of myself. And then, but we did a lot of, we're still doing the same thing, 12 steps, CBT. But a lot of the Colombo plan, I did it Colombo plan style, role plays, group reports, etc. So turning out pretty good. I was afraid that, I have people here with mental issues aside from addiction, bipolars. Um, but surprisingly, they're doing well with all these activities that we do. The activities we do Colombo plan style. So the adjustment was basically give them more assignments, but still in a unconditional positive regard. So they step up, and that's inspiring for me when I see people stepping up, and and then also we had to start doing our family therapies online. So the families were worried because the usual, but we were able to do that online. So I think we got that down pretty pat. So adjusting the live and face-to-face sessions online. That was a bit of a challenge in the beginning, but I think we've gotten it down pat now. So now we have about one or twice, 2 sessions every week for each family. And so basically that's it. It's still an adjustment for us. Now it's becoming loose. The quarantines are loosening up. You can go to the malls, but all the restaurants are not really. Some of the restaurants are opening up, but nobody's really going out because the virus is still there and there's really no vaccine yet. So it's just maybe we'll just continue with the same protocols that we've been doing from the beginning of the lockdowns to be safe. No? So, but generally, it's been I've tried to I'm looking at it as a learning experience for me. So everybody's going online for the support group meetings. That is so we have everybody has their own support group meetings aside from the ones that they attend regularly. So we have the gamblers attending the Gamblers Anonymous meetings, and we have the relationship people with issues in relationships attending CODA meetings. So this is quite a surprise, and it's I can see people stepping up. and doing what they can in recovery. What's sad is I've had a lot of inquiries. People want to come in, but because of the strict travel restrictions, it's really difficult to get into rehab now. Some hospitals were still closed. We're not admitting clients for detox, and I think it's only now, but it's an added cost because even before you get into detox, they have to be screened, and the tests are expensive. It's coming out. I think the one in the private hospitals is going up to as much as $300 per test, and there's an additional cost of private rooms, isolation nurses, and watchers. So it's an additional cost of about $1,000 just to get not even getting into detox, and then the cost of transporting. So we have to use a service that's been basically accredited. It's a lot of. It's very difficult. The access to treatment has become very daunting, but this is to protect the clients already in treatment, and I think this is a necessary protocol. But it's really sad for the addicts who are still out there. It'll be very difficult for them to access recovery. Uh, and I know that addicts alone with their own thoughts are the worst company in the world. So to address that, we actually did the UTC 7 training here in-house, crisis management. The idea was we're gonna back into the radio because I'm expecting, and there's a liquor ban, so you know what happens when alcoholics can't access liquor, so that's pretty crazy. So hopefully I've done one show so far, but I think I'm just waiting to get a regular show at least once a week from the church. So it's an hour every week to reach out to the people, to the alcoholics and the addicts who are isolated and quarantined, and also may not have access to internet. So we're gonna go on the AM band, so they can call or whatever, play around, joke around, mess around with us on air. And so I'll have the clients here who are all in recovery. So they're inspired, they're motivated, excited to do the show. They were afraid because what about suicide? So it's like, we talked drinking with the suicide, handling suicide in the UTC 7, right? Use the gate, so open gate.
This time,
yeah.
Yeah, this time
Yes,
UTC is UTC crisis management module very useful for us, I think.
Yeah. So we gave them a certificate. I'm an education provider in the Philippines, so they ended up getting the Colombo Plan certificate with the usual. I added hours because I had to spread out the training to 10 days from the regular UTC 7. It's only supposed to be 2 days, but I'm only one person, so I spread it out to 3 hours a day over 10 days. So they got more hours. I don't know if that's allowed by Colombo Plan.
Excellent.
But it's fun. It was fun.
Yeah. You are doing excellent job. Just you tell me how much is cost for the COVID test in Philippines?
It depends on the laboratory. The more the one that goes into the detox, it was going to as much as $200 to $300. But here in Baguio, I think we can get the private for about under $50.
So expensive, very expensive.
It's very expensive, and the test may be getting more accessible. Then the problem is with the lab results. Somebody died waiting for sorry.
Test in Bangladesh.
Somebody died waiting at the bus station to get the test results. Sorry,
okay, the same situation in Bangladesh is a $50, around $50 to $60 for private setup, and only $12 in government setup for the test. But it's very difficult to get chance. No, it's a long queue and huge rush in the test session. Now, thank you very much for your excellent answer. Now I am going to Rachita, but so many questions and viewers, some comments. will later we will come to see the comments. But I have a question to Rasita. In like Aditi, the like same question. What are the precautions that you are taking while admitting the new patient at your center at this moment?
Okay, so actually in Indonesia, we're not in lockdown. As I said before, like we're in a large scale of social restriction, which is requires like office, schools, places, and worship and public spaces to close. But the treatment center, like in my treatment center, we still open and we still give the treatment to our clients. And before I start to explain about the precaution that we are taking while admitting a new client in our facility, I inform you all that our last admission for voluntary client was in April. Okay, so right now, due to our government and board regulations to minimize the risk of the infection of COVID-19, we are not accepting clients except for the clients with compulsory status, which is they have a legal condition. Okay, so we do have like procedures and protocols in order to precautions while admitting new clients. Right now, we have like about 80 protocols that we made it special for our services during this pandemic, included general services, medical services, and also social services. So now I'm going to explain about our protocol of new admission, which is to precaution. First, we don't accept offline registration. So we only accept clients who already registered through our hotline number. So we will give them a call, and then our assessment staff will run an online assessment with the potential clients. Okay, so based on the online assessment, which is if the result that the client eligible to get in our treatment, we will make an appointment with them to come to our facility. So when they came to our facility, our staff will accept them with COVID-19 protocols, which they will wearing PPE level 3 like hazmat, goggles, face shield, the hand screen, and etc. Then the client or the potential client will get a rapid test. So if the result of the rapid test is non-reactive, then they will continue to offline assessment to make sure and to validate their online assessment. Okay, so after it all complete, we will take them to our quarantine facility. So we provide them with a facility to quarantine, to self-quarantine, and they will stay at the facility for 14 days in order to self-quarantine and to make sure that the person won't get contact to anybody before we are sure that they are not infected by COVID-19. So after 14 days, then they will continue to another services like physical examination, join to entry unit, and one-on-one counseling with the counselor, and etc. So that's all the precaution that we take in our facility.
What type of precaution your staffs are taking that admission period? Not only clients, and staffs also need to take some precaution.
Yes, okay. So our staff also have a rapid test. So right now we have like a work schedule in the two groups. So we call it like a restricted area. So if anybody can come to our facility, only for the staff to go in duty. So we have two types of groups. Group A will stay in our facility for 3 weeks, and then we change to Group B, 3 weeks, another 3 weeks. And after the change of the stage, we will have a rapid test. So before everyone enters to our facility, they will have a rapid test. And also,
thank you.
And also, we provide our staff with the information about the COVID-19, updating information about the COVID-19. So make sure that all of us updating and know about nowadays situation about COVID-19.
Thank you, Rachita. Now I'm going to see some question from our viewers. One question from hello everyone. Thank you for your important discussion. Thank you to you. Happy to see you in all discussion. Hope this would help us to understand the regional situation. True, we will discuss more in regional situation. Rima Turk from Lebanon. Thank you, Rima. Interesting regional dialogue. Thank you for your comments. Veronica Marvik, Miss Veronica Makati, listening. I think she's from Philippines. I think Makati is Philippines. Yeah, and Daniel is I am a social worker watching from the Philippines. Thank you, Daniel. Masudrana it's a great initiative. Through this program, we can gather knowledge and apply in our organization effectively during the COVID-19. Thank you very much for your comments. Abdul Razzaq, important discussion. Anyone can join to enrich his or her knowledge. Thank you, Abdul Razzaq. We will see later some question and some comments. Now I'm coming to again, Aditi. What do you suggest that the general population must do for their mental well-being during the current situation? I am asking in the general population, because you are the not only the addiction counselor, you are the counselor and one of the frontliner in especially Chennai, and your organization TTK is very renowned in our subcontinent. So I would like to know about in mental health services for in general population.
Yeah, so basically, people who could sustain the lockdown economically, or they were 2 months lockdown, they didn't earn money, but it didn't affect them much economically, had not got affected so much mentally. I would say that way, that they were scared and they had a fear about COVID, what's going to happen, the uncertainty. However, they were like 2 months they could spend time with the family, so their mental health was much better. They thought a lot of things were not like hobbies and things. People started doing their hobbies because they couldn't get time during their normal working day. They were also busy doing mending the houses, or their own work, or keeping a personal fitness, giving more importance to that. So those people, I would say, were mentally not so much affected as, but that in India, most of the population lives under the are economically challenged, or they are the like daily wage workers, and they don't earn money during this time. They don't have jobs, and they are also working in some different states, and they were the ones who had the hardest hit, because they were not earning anything. They also live in very small dwellings. So in one house, when the lockdowns were called for, they were living about 6 or 10 people in one little room, and that actually gave rise to a lot of mental issues. Like there are a lot of irritability, a lot of frustration, a lot of anger, domestic violence, as I mentioned earlier, raised because of this. Very uncertainty about future, whether I'm going to get a job or not, how am I going to earn money, how am I going to feed the my own family members. And they were the ones who needed that the care and attention more. That is what was seen throughout across India. So there were a lot of NGOs, or a lot of government schemes were being given to these people. A lot of people, like their own community people, helped a lot of their own fellow members who were suffering from these things. However, there were a lot of people who jumped into going back to their own villages, and they were the ones who suffered remarkably. And so our suggestion was, I mean, TTK was closed down, as you mentioned, because it was in the red zone. And so there were helplines being maintained, and people who felt very disturbed, or as Danai said, a lot of depression and anxiety raised. So they were held by the psychiatrist online. And there were also basically some pharmacies were, because medical shops and pharmacies were open throughout. And so if any medicines were needed, then the doctors would see them in their clinics and help them to buy some medicines to calm them down. I would only say that for people who have suffered the hardest, not to lose hope, not to lose your confidence. Take help from whatever schemes or whatever the NGOs were helping them, the aids that they were giving. This is going to pass off. The maintain your own health, and increase your immunity, so that you can sustain throughout till everything comes down to normalcy, which is going to take a very long time. But also there are a lot of, now we are opening up after 2 months in India, so maybe there are a lot of little job opportunities which are coming up. So take up a job that you get immediately, and unless you have a hope, you can't see the silver lining in this dark cloud of COVID. So sustain, and take one day at a time, I would say, and go ahead. And there is a hope that we all are going to come through this. instead of taking any random and getting anxious and having a kind of. So all these things helped. The helplines helped, the psychiatrists helped, and so that's how we were able to contain it.
Thank you. Two points come from your dialogue discussion. Hope and confidence is very important. We should always hopeful, and we don't lose our confidence. We try to continue our work with strong confidence. Daniel, good evening, sir. Junjun. Daniel. Hey, Aditya, how is Shantidi and Thirudi? They are fine. Both are fine.
Yeah, they are doing fine.
Yeah.
So Shanti ma'am is in her own village called Manjakudi. And Thiru is very much in Chennai, I guess. I haven't met her, but yeah, she must be there. We all are doing fine. Thank you.
Give regards to them, no?
Yeah, sure. Sure.
Okay. Amir Hussain.
May comment on what Aditi said. Just add, we all know that one of the main challenges of recovery is the coming out of the drug and the alcohol. There's a lot of anxiety, and because of this new threat, the corona, or so we say the Wuhan virus, so that's a very strong, and that's an anxiety that is real, and it's not just as of now. It is not a threat that will go away. So it will just be there for until some medical breakthroughs are achieved. And so this is an extra, this is an additional challenge that is put on us as service, people with addiction, who help in the addiction field. Because as normally we provide our clients with coping mechanisms and to all of these anxieties and when they go home and all of that. But now we have this, and then there is uncertainty on how it's going to be for maybe the next, at least for the next 1-2 years. So there are going to be so that's the stages of change. The grieving process techniques will really come in handy. Our clients have to go through this grieving process with not just their lifestyle with the drugs, but also with the expected lifestyle of the regular recovery. But now it's recovery plus without meetings, no physical meetings, but only online. So lifestyle expectations, adjustments to the expectations have to be. We have to facilitate that, and aside from the clients, also for ourselves. One example for me is usually DT and I we also do a lot of trainings, and now all of a sudden we don't go to hotels anymore. No more buffet breakfast, no lunch buffet. We have to do training from where we are. That's really sad, but I miss that. But then we have to adjust because I like what our director, Colombo Plan, Natalie said. We have to continue providing support to our students, not just, and for us, not as trainers, not just students, but also our clients. So for the one day at a time is really helpful. Not to think about the future, but focus on the present. So coming up with activities that brings the mind to the present, like planting, crochet, and also the mindfulness exercises, meditation, that helps. The imaging, those also help. Netflix for me is a big help, So I've been binging on a lot of series. Now I'm into espionage. The Zoom meetings, the Zoom platforms have been really been very good. So teaching and motivating on the challenges, because some of the clients go into depression. So one of the challenges is really motivating to explore the available help online. Some of my clients are supposed to be going back to school. So now they have to adjust and do all of this school work from, online. And so I think the main really is hope and confidence for sure. But to achieve that, we have to increase the self-efficacy of our clients. So to achieve the confidence. and to expand, have better hope. So what do we do when there's anxiety? What do we do when there is fear? So we like to say replace fear with faith and planning and training, new skills. So that's what I have to share for. I did a little focus group discussion with our clients here, so it was very interesting. Um, so we got stuck in the middle and late recovery stages because of the corona. How are you gonna? It's kind of hard to do exit plans now. Uh, how do you do exit plan? Are we gonna go to school? What are the available employment when we get out of treatment? So that's all new skills. Everything will demand new skills. So I don't know what's your take on that. But that's some of the
Uh,
things that I've been learning for the past 90
uh,
days with my clients. Yeah, yes, it was.
okay. Thank you for your excellent sharing and supplements. I have a question about mental health situation again. Danai, Mr. Danai, have you noticed that trend or emergency for the specific mental health issue during COVID-19, like OCD?
Yeah, usually more anxiety, and especially for the patients with OCD, they are suffering from because they are afraid about getting infectious, about contagion, or maybe pandemics in the right now. So they tend to have more high anxiety than usual, and also it can create lead to like panic attack. And also, but some patients also they tend to drink more than usual or use substance during this time. This is very important issues right now also. And I think apart from the not only OCD patients, but I think most of the patients also with some psychiatric patients right now, they have some difficulties in accessing to the treatment to the service providers. Sometimes about with the discontinuing of the medications, sometimes it can affect their mental health as well. So these are some issues, and we found out that there are. I'm not sure from my notice. I think more visits for anxiety attack at the emergency room is more common than usual, and also for the we call it intoxication from the substance like drinking, and also from the cannabis comes to visit in our emergency room. Yes, during this outbreak.
Uh, do you have any suggestion to the SUD to manage the panic and OCD?
Okay, so I think right now they are because right now this pandemic is very stressful, and not only from the infection itself, but like Aditi said about the economical consequences after COVID outbreak, right?
Yeah.
So sometimes there are some anxiety that everyone is facing, but we have to think about what that we can do right now in this crisis. We can think about what did we do when we face the crisis in the past, and what this is the thing that we can do right now. There are something that we can control, but sometimes something that we cannot control at all. So we have to focus on about things that we can do right now. What is the next step? What is a good thing to do right now? Maybe focus on here and now and about the things that we can do. Sometimes we have to just to wait and time. Like Aditi said, that this is just only for some period of time. It's not crisis doesn't mean that it will last forever. So there are some times that that will be better, but right now just focus on here and now. What is the thing that you can do, yeah, to solve your
Uh,
problems.
yeah, we need to be hopeful, no? When we look to
Yeah,
future and as well as
yeah,
present. Yeah, just check with my viewers, and there is some comments. Amir Hussain, welcome to all guests. Thank you, Amir Hussain. Daniel, thank you for welcoming us. Mahafida Dina, hope to see you all. Happy to see you all. I have question to Aditi and Danai. Have you started COVID-19 test when SUD patient admit in rehabilitation center? She is asking to Aditi and Danai. So, Thailand and India.
Yeah. So Dana, you want to go first?
all right. So
Okay.
in Thailand we don't do the test for every patients who come for SUD treatment. Right now, we have our national screening tools for COVID test only. It's usually it's like a questionnaire about the risk. There are some behavioral risks also about that, like travel history or about some symptoms that may be related to the COVID test. But for the patients who has the high risk to COVID test, usually we will identify this patient and also to be referred to the some test first before admitting to admitted to the hospital. But not everyone will have to do the test. We do the screening because like Jun said right about the price, and also the queue for the test is very long. Yeah, so we choose the like a national we have national screening tools, and also the body temperature is very important right now. And also the test.
Okay, Aditi, please.
Yeah, so so it's a similar one. Basically, for the rehab centers which are admitting the clients, they do, as I told you earlier, they do have a screening for COVID. So they first of all see apparent signs of any COVID infection, like fever or any other signs which are typical signs of COVID, even if they are not COVID. But then they would not admit that client immediately. They would send him for further investigation to a medical ward, and then maybe if he's negative, then bring him back after 14 days. But there are some times where the clients are asymptomatic, and you don't know. So body temperature is also checked in these rehab centers which are working, and of course they admit the client, and every day there is a the doctor will do the similar kind of screening for these clients who are admitted, so that he gets it quite early and then be able to help the client. So not for everybody the COVID tests are done. Again, the same problem, that there's a long queue for the test. Although in India there are for the lower socioeconomic group, the government has made the test free of cost, but otherwise it's about $30 to $40 a test in a private clinic. So yeah, so that's the thing.
Thank you for your sharing, Aditi. I have a very important question to Rachita. We know the tobacco is very dangerous for the COVID-19, and WHO already alert us because tobacco consumption or smoking directly affect with our pulmonary system and lung and damage our lung. And how you motivate your patients to quit smoking in at current situation? Would you tell this about the smoking-free environment?
Yes, okay. So for another information, that in our facility, free of smoking. So this is a free for smoking area in our facility since 2019. So it started last year. So actually in BNN we have like 5 deputies, and our rehabilitation center right under the deputy of rehabilitation center. So some of our colleagues make a research about our client conditions, like the effect of the tobacco to their respiratory system and etc. So then finally we have a regulation that all clients have to our facility, they have to quit smoking. Okay, so because this is the regulation and we have to socialize to our clients, so we have like 3 months to preparing about the new regulation. We invite our clients to have a discussion forum, and then we also accept about maybe the thinking about the new regulation, and then we also give a socialization to our client and also for the staff, because as you know our staff also have a smoking, so we have to socialization for them. And then I have to say that it was hard at the beginning because there's a lot of protests and etc. But again, the rules, that's the rules. Then we already give information for our clients before they decide to join in our facility, so they already sign an informed consent that okay, they're okay with the regulation. And when they join in our facility, we also provide them. We have like seminars in our facility, both in medical rehabilitation and also in social rehabilitation. For medical rehabilitation, we will give them some seminars. We call it moving class. We have a program, we call it moving class. So we will give an assessment to them, and then we will give them some seminars. Like for the medical rehabilitation, is like physical disease and comorbidity, and then recovery and stages of recovery, oral health, and then addiction. Yes, and then addiction. Yeah, and when they and after they finish the medical rehabilitation, we will send them into social rehabilitation. And in social rehabilitation, we will give them some seminars like relapse prevention, the communication skills, and what else? Anger management, a healthy relationship, a healthy lifestyle. So we make sure that our clients get staff or we provide them with education.
Thank you, Rachita. What about Philippines, Junjun and Aditi? Your center allow smoking in your center? In Bangladesh and our center last 13 years is we are maintaining the smoke-free environment. We are not allow any staffs and clients to smoke in our premises. It's completely smoke-free. What about Aditi and Junjun?
Okay, so in the centers that I know, smoking is, I would say, officially banned, but then people still get in the cigarettes and smoke, which is a fact. And sometimes we allow them, I mean, even when they go out, we don't allow them to smoke inside the center, but when they go out, they have clearly decided not to quit smoking. You need to work on it little later because they are quitting one substance at a time. So we don't insist that they quit all the substances at a time. So sometimes you need to work on them during your follow-up time and the recovery time, and then we work on their smoking thing. So some of them are able to give up smoking, and we do help them with the substitute things and taper it down, and a therapy is given for that. Every counselor knows how to do that. But again, as you know, it depends on the patient who really wants to quit or not. So when they are inside the program, they don't do it. But when they go out, they tell us that they're going to continue smoking, but they need to work on it. So that's how we handle it.
Same in our country. Junjun.
Yeah, I'm on the same thought with Aditi. Here, we have I don't smoke. I stopped smoking for already stopped for about 13 years. Um, but we have a designated area for smoking. In my mind, because some clients have co-occurring disorders, and smoking does have relaxing for some of people with who have really difficulty stopping smoking, even though they have a strong desire. The inability to stop is an indication of a co-occurring mental disorder, mental issue, and we have a high anxiety. Taking away the drug and the alcohol is already a high anxiety situation, and then plus the coronavirus, that's another high anxiety. And then we are supposed to be. I'm teaching them skills, uh, a lot of skills, and it's very hard to learn new stuff if you're anxious. So so we just have basically we have we encourage you to stop smoking. No smoking in most of the house, but you can basically smoke in a certain area only, and then there are fines if you get caught smoking in the other areas. So it's a UPR,
Thank you.
unconditional positive reward.
We have a question from Amir Hussain. COVID-19 creating mental health vulnerabilities and it's alarming. If SUD not noticed properly now, is there any chance to see another pandemic like mental health disorder pandemic? I'm asking to answer Mr. Danai because this is related to mental health. This question from Mr. Amir Hussain.
You mean the pandemic of mental health?
Yes, here,
right?
You're mentioning. Yeah.
Okay. It can be like, for example, I think I'm not sure. It's not to use the word pandemic, but sometimes like some stressful events, like for example, like a threatens to our planet or other things. This also can create like anxiety globally, for example. But they are more specific about that. For example, like for anxiety, it depends on your like belief, attitude, and also one thing is about this is one factor is about the cultural factors. For example, each continent, each countries, each ethnicity, they have we have their own we our own like beliefs and some sets of thoughts. For example, these are also can be one factors that can make some, even though the same events happens in globally, but maybe we can view it differently. For example, but it's I'm not sure. I don't think I don't I'm not, I don't think to use it's not good to use the word pandemic mental health, but like the some threatens, like for example like a world war. For example, this can create like anxiety and fear, and also it can lead, but not everyone can will develop the mental disorder according to these traits, because our resilience, our background, and cultural factors, like I said, can plays a role also. Not only one single factors. Mhm. Yeah.
Thank you. I hope Amir will get his answer. Jahangir Hussain Bokul, very important discussion in the session. Thank you, all guests. Daniel, well experienced product, ma'am Rosita, Rubayat from Rubayat, a very meaningful discussion. It would help us to enrich our knowledge about the mental health during the pandemic and from the regional experts, and use it accordingly in our region organization in on time. Thank you, Rubayat, for your comments. Azizul Hakim's comments says a good job. Mr. Amir Hussain again, is SUD is not itself a mental health disorder? Can it making a controversy by treating it difficulty? Aditi, I am referring to you. Question is from Mr. Amir. Is SUD is not itself a mental disorder? Can it making controversy by treating it difficulties? Just I am asking you.
Yeah, so what I understood from your question is SUD a mental disorder? Well, it is categorized in the DSM-5 as part of a mental disorder, addiction, but it's a separate category. It has 11 criteria and you can diagnose SUD. And what is the second part of the question?
Just one question.
Yeah.
I'm just is SUD is not itself a mental disorder? Can it making controversy by treating difficulties differently?
Differently, okay, not
Yeah,
difficulty.
differently.
Yeah,
I'm
so
sorry.
we are not treating SUD differently. Basically, it's a when you treat an SUD client, we also screen him for the his mental health. We also figure out what are the different comorbidities or co-occurring disorders with him, because SUD can lead to a co-occurring disorder. A co-occurring disorder guy can also get into SUD. So they go hand in gloves actually. So we do work with the psychiatrist and figure out, because anxiety, depression are very common amongst SUD users. And so we need, as he said, panic disorders. All these are hand in gloves when you use different kinds of substances. So when one is treating SUD, you cannot neglect mental health of the person. You need to screen him for some of the co-occurring disorders, and if you feel that the guy requires a treatment, then he is definitely given the medication and the kind of counseling regarding. So it is treated in an integrated way together. So one doesn't come first and the other second. So it's treated together. Yes.
Thank you. Screening is very important. Mr. Danai, would you tell us a little bit about the screening? How the screen identify the SUD as a mental health disorder? What type of symptoms and behavior we can see as a mental health disorder SUD?
You mean the screening for SUD, right?
Yes.
Or some symptoms. For example,
Yeah.
it can be like some physical symptoms, like for example, like from the withdrawal that can be specific to specific substance, and it other words is other terms is called tolerance. It means like this some of the physical symptoms like the brain is tolerate to the substance effects, so you need a higher doses, and also you spend more time on the substance. And also other things about the behavioral symptoms, like sometimes like Aditi said about anxiety, depressed mood, or mood swings also, or maybe are some physiological symptoms like sleeping. These are some symptoms that can be seen in a patient with SUD. And the other one is about some specific to maybe consequences. Usually most of the patients know about that there are negative consequences from substance use, but they cannot control their use. They cannot stop by their own. They try, but they fail with this for this attempt. And also other thing is about some these sub problems. Usually it has to needs some time. For example, at least about 12 months for these problems exist. And also it needs to disturb functions, and also it needs to impair about some like some most of the area of our life. For example, like physical problems, psychological problems, and also social or interaction with relationship with other people. Okay.
I have a curiosity about the Bangkok hospital where you work. Bangkok
Yeah.
hospital is very, very popular in Bangladesh also. So many Bangladeshis went Thailand to take treatment from Bangkok, Bamungrad, and Samiteve Hospital.
Yeah.
I have a query a little bit for my curiosity. Do you have any inpatient service for the SUD, or you providing outpatient service for the SUD? I know Bangkok Hospital is very big and providing in general health services, but especially for SUD, please.
Yeah. There is actually there are not specific units for SUD, but for SUD, like I said, because it belongs to one of the category in the DSM-5 as a one of the mental disorder. So we have the Department of Mental Health in our Bangkok hospital. But most of the Bangkok hospital, they can provide outpatient treatment, except in Bangkok. And I think in Bangkok and in Pattaya, there are two hospitals that can provide inpatient treatment because they have a psychiatric ward, and they can provide assessment, treatment, detoxification, and short rehabilitation. But for other hospitals, we can accept just for detoxifications only. For example, like for short stay to stabilize patient symptoms from withdrawal symptoms, from agitations after stop using substance. Just only for detoxification. But for in Bangkok and I think in Pattaya, these two has a psychiatric ward, so they can accept short-term rehabilitation.
Okay. Thank you. I had visited Thaniak Hospital in Bangkok. It's too big, and they are providing is a huge area. They are providing female services, psychiatric services, OST, rehab, TC, everything is there. Excellent hospital. I had visited. Thank you, Danai. 2 or 3 more questions. Mr. Jahangir Hossain Bokul, very good job. Tasib Khan, good solution. Aisab, great session. Thank you, Aisab. You are with us. You are watching us. Thank you. K. Islam, many people in Bangladesh now having symptoms of COVID, but they are not interested to test. I had to tell from them that if he tests COVID-19 and it is positive, through he will very shocked and suffering from the mental disorder. So he is not interested to test. What are the suggestions for them? It's 2 things. Due to social stigma, people do not want to admit he's some symptom. He's got some symptoms of COVID-19 due to social stigma and very limited health service. Because if they admit he's getting some COVID-19 symptoms, then family will not cooperate, society will not cooperate. That's why some people sometimes hiding. Would you? I want to request Aditi to tell about this social stigma and related answer.
So social stigma related to COVID or social stigma related to substance use disorder?
No, he's asking related to COVID.
Yeah,
People
okay.
do not want to go to test because they have symptoms but do not want to go test.
Actually, yeah, I would say it's more than a stigma, it's more of a fear because they feel that they would die, and then there are lack of medical facilities to get admitted in a COVID ward. So in a country like India where there is so much of a population, and everybody wanting ventilators, and you see pictures on the TV, even younger people dying. So it's more of a fear more than the stigma attached to it. Also, socially, people don't accept you. Like, even if you are positive and you want to be quarantined in your own home, then your entire, probably if you're living in apartments, the other people might object. Why are you staying here? You need to go to a COVID ward. And that has happened in some of the places. So that's why people are scared to get tested. But in case in India, I would say that if a patient goes to a physician or a doctor, and the doctor says that he needs to get a COVID test done, and the patient has to do it, then it's mandatory that the test has to be done and reported to the government authorities, and then go to the COVID wards, which are COVID hospital or a COVID ward where he has to get admitted. So there are certain private hospitals which are catering to admit the COVID patients, as well as the public hospitals or the civil hospitals of that area. So the patient can choose if there is space. But to tell you honestly, most of the wards are full. So if it is an older patient and he requires help, then you really have to search pillar to post for a ventilator. And so it's more of a fear, it's more of a concern or an anxiety, what would happen if I test positive. And it's not only to that individual who's going through it, it's also to the whole family. Because if an individual is tested, then the whole family has to get tested, at least in my country, has to undergo that whole testing. So it's kind of a more of a fear and anxiety that plays out.
Thank you. Already we crossed 1 hour 6 minute. We will close, and before that, Abul Hussein asked a question. This discussion is very fruitful and stable mental condition during the COVID pandemic. Thank you, Abul Hussein. Before conclusion and going to close, I want to ask Rasita. I want to request Rasita for a song. I watch you sometime post in your Facebook and you singing a song, so you can play now.
Yes, of course. Actually, at the first, I thought that I was in a Yellow Submarine and asking Jun to dance, and then I changed my mind. I was singing a song from Bob Marley, which is the title of the song is Three Little Birds, because I thought that the song is appropriate for the situation to make us sure that everything will be okay. Okay. So, well, I'm not a professional singer, so I'm sorry if there's a lot of mistakes.
That's just a energizer. Treating as energizer. No?
Okay, this is energizer. Don't worry about a thing. You can sing with me. Cause every little thing is gonna be alright. Sing, don't worry about a thing. Okay, Ginger. Cause every little thing is gonna be alright. Rise up this morning, smile at the rising sun. Three little birds perched by my doorstep, singing sweet songs of melodies pure and free, saying, "This is my message to you." Yeah, together, singing, "Don't worry about a thing." Cause every little thing gonna be alright. I'm saying don't worry about a thing. Cause every little thing gonna be alright. Gonna be alright. Yay!
All right.
Thank you. Rachita. Next time we will request more in Sri Lanka and anywhere we meet. No, and I hope again you have an amazing voice, Rasita.
Thank
From
you.
ISAP, yeah, ISAP comments really excellent. Now we will close our. We are going to close our session. Before closing, I would like to request start from Danai. Say something to our viewers for some hopeful words to our viewers. They can manage this situation. As a psychiatrist, we are requesting you.
Okay, so I hope that everyone stays safe. And I understand that now everyone is affected with this COVID outbreak, and we have to adjust to our, in Thailand we call the new normal. It's like a new behavior, new lifestyle that we should be that should be changed and adjusted. So, but I hope that everything is going to be okay soon in every corner in the world, and hope that you stay safe, and so that you can like have so self-care is very important, about good food, good sleep, and also about find a way to relax, and also be distract yourself maybe, and also sometimes about too much information is not good. Also try to limit information intake as well, and find the trust source of information is very important, because we find out that some rumors or some hate speech and other thing can affect our mental health issue as well. So hope everyone stay safe, and I hope that we all can get through this together. Thank you.
Okay, so
Okay.
I would say that to add to what Danai said, having a hope and confidence, basically maintain sanitation and hygiene, continue maintaining it even if, you know, places, the lockdown has opened up. Wear a mask whenever you go to public or a crowded place. And of course, maintain social distancing, because this is what is important for us, and that will keep us safe and healthy. And of course, remain healthy, stay home as much as you can. Thank you so much for watching.
Okay, so what happened to Iqbal? Anyway, so I'll
I,
continue.
I,
Do you
I'm
want
extremely
to?
sorry.
So we
The
cannot
network,
travel.
yeah,
We can't travel
network,
out. So we
yeah,
can. I guess the thing to do is just travel in.
yeah.
Travel in is exploring the self, learning new stuff, making use of the internet, going online and connecting with. Actually, I've connected with really old friends from college, and haven't seen or talked with in many decades, and it was a good experience. So the this experience has taught me to learn to seek the positive and avoid all this too much news. As the night said, all the news is really disconcerting most of the time, 99% of the time. So we go to YouTube. I've taken tours, walking tours in Rome, walking tours in Hungary, or walking tours in France on YouTube. So I can't go there, so I use the YouTube. And also using the YouTube to see all the concerts, the live concerts I missed, Andre Bocelli, it's all those guys. So these are new stuff that's new to me, and stay positive. That's all I can say. Try to stay positive, avoid the negative, but stay negative, Corona negative. So God bless everybody, and Iqbal, really good job. This is a really good thing that you've done. So I miss my co-trainers. I miss you guys. It's really good. We had at least one more episode in Colombo before we got locked down. It was like a few days later, then boom, everything's closed. That was really good. So, oh yeah, I just wanted to share. I've learned how to cook roti, yeah, Sri Lankan food during the quarantine. So, Aditi, I'm still waiting for the apapan. So you promised me apapan, right?
Apam, apam.
Apam. Okay. Rosita?
Okay,
Okay, so now it's my turn, right?
No, one
Oh,
comments
no.
for Rachita.
Okay.
Indeed, Rachita, indeed you are a good singer, very good singer. Your smile is more pretty. For comments for
Thank
you.
you. Okay.
Please go ahead.
So
Go
now,
ahead.
okay. So I have some points here for my closing statement. Where first, please follow any guidance or protocols or procedure that has been made by our government or board and etc. And then have a routine like creative activities and to avoid your boredom, and also have a social contact with your loved ones, and please aware of your burnout, or I can say that please take care of yourself before you take care of another person. You have to take care of yourself first. This is very crucial for us as an interventionist. And also, don't discriminate against people for every reason. Just like maybe the state of COVID-19, people may have the COVID-19 or health workers and etc. And also, the last one is mental health and psychosocial support has to be accessible and adapted appropriately for every needs. And I do hope that please stay safe and stay healthy, everyone. God bless you all, and I can't wait to see you soon in our second session of Chat to You.
Yeah, thank you, Aditi.
I already said mine, but when
Okay,
you want.
Sorry
I
for
missed anyway. I missed. Thank you.
Thank you
Thank
so
you,
much.
viewers. Thank you, viewers. To ensure sustained sovereignty of SUD, we must support people in recovery who need access to health and especially mental health, stable housing, and community support. Thank you, viewers, for your active participation in live program. Stay safe and goodbye. Hope see you
You,
soon with a new episode. Thank you very much. Thank you, our guest, and thank you, our viewers again. Thank you.
Thank you, everyone.
thank you so much.
Thank you, everyone.